My name is Gabriella Faltz. First, I will check the doctor's orders and write any pertinent information down on my worksheet. My patient's name is Sid Garland. His birthday is November 8th, 1965. He's allergic to penicillin and codeine. And his MRN number is 344316. He was admitted for appendicitis. And I will check through the doctor's orders to find what type of saline I will be using. The doctor says to cleanse the wound with normal saline every 3 days to change the dressing. All right. I will then perform hand hygiene by washing my hands, and I will gather all the necessary supplies needed. And then I will knock on the door to warn the patient that I am entering. I will then introduce myself to the patient. Hi there, my name is Gabriella Falls. I'm a student nurse with Durham College, and I will be performing your sterile dressing today, the change. Is that okay with you? The patient will then consent and let me know that it's okay. I will then confirm the patient with my worksheet. I will ask the patient to verbalize his name, date of birth, and any allergies he may have, and it all checks out, as well as at the same time I will reference his MRN number and check the red wristband to see his allergies. I will then assess his need to void, as well as his pain on a scale of 1 to 10, both of which he's okay with. I will then do a quick environmental scan before beginning. I will check the oxygen and the suction. I will check for any clutter around the bed, which there is none. I'll check the bed breaks as well as the rails, and I will make sure the rail opposing me is up during the procedure, and I'll make sure the call bell is wrapped around the railing. I will then raise the bed to working height, and I'll prepare the client for the procedure. At this time, I have a garbage with me, which I will open at the end of the patient's bed, asking if it's okay, and they have said that it's fine. Okay, and then I'll organize myself accordingly. Normally when there is a sterile field open, there's no speaking, but for the purposes of this critique, I'll be verbalizing throughout. This lab kit, there's 2. I will only be needing 1, so I'll toss that in the garbage. will then add any extra packages to my field, stepping away, checking that it's the right package and that it's not compromised in any way. And I will do this for each package. I will then take my normal saline and make sure that it is the right solution. Check the expiry date on the bottle and it does work. I will then lip some into the garbage and then I will pour it into my sterile field. At this time I will don clean gloves to remove my patient's old dressing. And then I will assess my patient's wound. The fluid coming from the patient's wound is a minimal amount of drainage, serous sanguinous. And now I no longer need these forceps, so I'll also be dropping them into the garbage. At this time, I will remove my clean gloves and also drop them into the garbage. I will then don my sterile gloves. This time my dog is trying to enter the room, which is fine. He can enter. Unfortunately, this is done at home. He can enter. We have an audience today. Okay, I will then make sure to place my sterile drape to make sure the field is elongated, making sure to not compromise my sterile gloves in the process when I place it down. I will now begin the process of cleaning my patient's wound. I'll clean my patient's wound top to bottom, starting medially first on the midline. I'll then clean top to bottom distally. And finally, I will clean top to bottom proximally. I will then dry in the same fashion. And then I will drop it above waist height. And finally, same thing, top to bottom, proximally. At this point in time, I will drop the sterile forceps as I no longer need it. I will now assess the wound as it is clean. It is healing by primary intention. The edges are well approximated. There are 21 stitches, and there's a slight amount of redness, but nothing to indicate infection. At this time, I will place the patient's dressing to seal the wound. I'm using 2 4x4 gauzes as they were in the beginning. Then I will also drop this forceps into the garbage, and I will place my abdominal pad with the blue line up onto the wound. At this time, I will remove my sterile gloves. Placing them into the garbage as well. And then I will use the tape to tape up my patient's wound. I will then clear my space, disposing of any of the sharp forceps or the biohazardous material accordingly into the separate garbages. I will ask my patient their comfort level as well as their pain level, and if they're okay, and remind them that their call bell is still left on their bed rail in case they do need to call me. I'll return them to proper position, and then I will hand wash, and I will leave the room.